Everyone, this is Dr. Deepti Warikoo, Department of Physiotherapy, Dolphin PG Institute of Biomedical and Natural Sciences. Our today's topic is fatigue. Muscle fatigue is a common complaint in clinical practice. In humans, muscle fatigue can be defined as exercise induced decrease in the ability to produce force. Here, to provide a general understanding and describe potential therapies for muscle fatigue, I will summarize about fatigue, the factors, the effects of fatigue. So, first of all, what is fatigue? Fatigue is a common non-specific symptom experienced by many people and is associated with many health conditions, often defined as an overwhelming sense of tiredness, lack of energy, and feeling of exhaustion. Fatigue relates to a difficulty in performing voluntary tasks. As fatigue sets in, force in your muscles reduces, muscle responses to brain stimuli reduces, and activity level decreases. Muscle fatigue is decline in the muscle force generated over sustained periods of activity or due to pathological issues. Fatigue accumulation, if not resolved, leads to overwork, chronic fatigue syndrome, overtraining syndrome, and even endocrine disorders, immunity dysfunctions, organic diseases, and a threat to human health. So, this is how difficult a fatigue could get for a person. Now, fatigue onset and rate of developments. First of all, we should know when and how fast fatigue kicks in is dependent upon the following things. What are the things are type of the activity, the muscle fiber type, type of the muscle contraction, intensity and duration of the activity which the person is performing, and the level of person's fitness. There are many different fatigue classification methods. According to its duration, fatigue can be classified into acute fatigue and chronic fatigue. Acute fatigue can be quickly relieved by a rest or lifestyle changes, whereas chronic fatigue is a condition defined as a persistent tiredness lasting more than months that is not relieved by rest. Fatigue can also be classified as mental fatigue, which refers to the cognitive or perceptual aspects of fatigue, and physical fatigue, which refers to the performance of the motor system. Fatigue is defined as a decrease in maximal force or power producing in response to contractile activity. So we can see a local fatigue in biceps muscles while we perform biceps curls. We can see a generalized body fatigue while we are performing an activity, and then we feel weak to perform that activity. Chronic fatigue is mainly seen in chronic fatigue syndromes, overtrainings, or recurring illness or injuries. Now, what are the key factors of the fatigue? Fatigue can originate at different levels of motor pathway and is usually divided into central and peripheral components. The peripheral fatigue is produced by changes at or distal to the neuromuscular junction. Central fatigue originates at central nervous system, which decreases the neural drive to the muscle. Muscle fatigue is a commonly experienced phenomena that limits athletic performance and other prolonged activities. The fuel depletion is the basic factor which is due to intramuscular ATP depletion, muscle glycogen, blood glucose. Then we can see the metabolic byproducts can also cause any alteration can cause fatigue, like hydrogen ions in plasma and muscle, inorganic phosphates, then adenosine diphosphate. Then neuromuscular events can also be a causative factors like decreasing firing of the central nervous system, impaired sodium and potassium pumps gradients. So, what are the causes of the fatigue? If there is iron imbalance within the muscle, if there is nervous fatigue and loss of desire to perform activity, metabolic fatigue, exercise and aging, and lactic acid accumulation. We mainly focus on lactic acid accumulation. So, what are the effects? It causes muscles to ache. We can see burning sensations. There is rapid breathing, fast breathing. Some patients may also feel nausea, vomitish, and there could be stomach pain. Also, patients come to us with that also. Now, what is this ion imbalance? Contraction of a muscle requires calcium ions to interact with troponin. exposing the acting binding sites to the myosin heads. Osmotically active molecules outside the muscles are lost through sweating, difficult for the required calcium ions to be delivered to the muscle fibers, which causes fatigue. Then we see the nervous fatigue and loss of desire. Nerves are responsible for controlling the contraction and force of the muscle production. The central nervous system, via central neurotransmitters, produce various excitatory and inhibitory inputs on the spinal motor neurons, thus ultimately activating motor units to achieve the force output. The strength and timing of contraction are controlled by the firing of motor units. When the first recruited in a healthy system, motor units usually fire 5 to 8 Hz. During brief, non fatiguing voluntary contractions in humans, the mean motor unit firing rates are 50 to 60 Hz. Motor units are required or de-recruited in an orderly fashion on basis of motor neuron size and then essentially control the amount of muscle time tissue being activated. Slowing of the firing of motor units contributes to the loss of force that marks the onset of fatigue. Then we will see the metabolic fatigue. The metabolic fatigue is mainly due to accumulation of metabolites from magnesium ions induced fatigue by interfering with the release of calcium ions. Neural activation results in signal transmission from the brain to the muscle transverse tubules, including the calcium release from the sarcoplasmic reticulums into the cytosol and initiating of cross-bridge cycling. This excitation contraction coupling process involves the following events. First, the action potential is generated at the neuromuscular junction and propagates along the surface membrane and then into the transverse tubules, where it is detected by the voltage sensor molecules, which in turn open the calcium channels in the adjacent sarcoplasmic reticulums and cause release of the calcium ions. The binding of calcium to the troponin moves tropomyosin away from the myosin binding sites, thus permitting cross-bridge cycling. So, impaired calcium release from the sarcoplasmic reticulum has been identified as a contributor to fatigue in isolated skeletal muscle fibers. There are several mechanisms in this which may cause metabolic fatigue. Next, we can see the ATP causes. We can see the ATP is generated for energy. So we need energy, we want ATP. Muscular work must be supported by ready supply of ATP energy. There are three major ATP releases that require ATP for the muscle activity. First is the sodium potassium ATPase, myosin ATPase, and calcium ion ATPase. The sodium potassium ATPase pumps sodium backs out and potassium backs into the fiber after an action potential. The myosin ATPase uses ATP to generate force and do work, and the calcium ion ATPase pumps calcium ions back into the sarcoplasmic reticulum, thus allowing the muscle to relax. The activities of these amount accounts for 10%, 60%, and 30% of total ATP usage. Glycogen is the carbohydrate energy store for ATP production. There are various subcellular localizations of the glycogen. It is a fundamental concept in the exercise physiology that glycogen is an important fuel during exercise. If glycogen is depleted, that is the ATP mechanism depletion occurs, glycogen depletion occurs, it may cause, affect the series of events and ultimately result in fatigue. And the basic mechanism for this is not fully understood. Then we move to the metabolic factors like the lactic acid. Lactic acid is the byproduct of anaerobic respiration, which strongly contributes to the muscle fatigue. So, the accumulation of this lactic acid is the basic cause for the your fatigue. Now you can see this lactic acid accumulation, which is caused due to acidosis, where the hydrogen ion completes with calcium ions for binding sites on troponin C. There is decreased maximal calcium ions activated, and patient also feels burning sensations while we see that this type of uh, uh, lactic acid accumulation is exaggerated. Now we can see fatigue is also there, increased exercises and aging. So, with sufficient training, the metabolic capacity of a muscle can change, delaying the onset of the muscle fatigue. With aging, levels of ATP, CTP, and myoglobin begin to decline, reducing muscle's ability to function. Muscle fibers basically shrink or are lost. In aerobic respiration, pyruvate produced by glycolysis is converted into additional ATP molecules and in the mitochondria via Krebs cycle. The pyruvate made in the cytoplasm is normally fed into the mitochondria where it is burned completely to carbon dioxide. When mitochondria are damaged and poisoned and do not work well, they will not be able to keep up with the inflow of the pyruvate. You can see here, if they are not able to keep up with the inflow of the pyruvate, there is exaggeration of the lactic acid. So we see lactic acid accumulation. When you exercise, your body uses oxygen to break down glucose for energy producing ATP required for the muscle contraction. Intense exercises, there may not be enough oxygen available to complete the process. So a substance called lactic acid is made. Reduced circulation to muscle may result in glycogen depletion and reducing endurance capacity. Therefore, more activity, reduced endurance capacity, increased fatigue. You can see there is fatigue which may lead both ways, aerobic glycolysis and anaerobic glycolysis. There is ATP depletion or there is lactic acid production. In anaerobic respiration with inefficient oxygen, pyruvate cannot enter the Krebs cycle and instead accumulates in the muscle fiber. So lactic acid accumulates, reduces, pH decreases to about 6.4 or 6.6, producing stinging feeling in muscles when exercising. So you feel fatigue, you feel inability to activity or sometimes difficulty in breathing or burning sensations. Because the bloodstream cannot deliver it as fast as it is required, lactic acid is transported to the liver where it can be stored prior to conversion to glucosin, the presence of oxygen via the Cori cycle. The amount of oxygen required to restore lactic acid, this is what we call as oxygen depth. So if we are having increase in oxygen depth, fatigue will be increasing. So to decrease fatigue, we need to do any exercise. Before any exercise, we need to do a warm-up exercises, and after the exercises, we need to do a cool-up session. So warm-up session is 20 minutes or a half an hour session where you perform few like small physical activities to increase your breathing and heart rate, increase the energy releasing reactions in the muscles, increase the blood flow to the muscles. So that is why warm-up is needed. Cool down gradually returns your body to its normal heart rate. It disperses lactic acid, which is produced during the exercise. This helps prevent muscle soreness, helps you to return to resting heart rate quicker, and pays back your oxygen depth. So, this is about fatigue and how it is caused and how we can deal with it. So, while we are doing some resistance exercises, we need to know that our patient can have fatigue syndromes. So we need to do a proper warm up sessions and a good cool down sessions. This will enhance the activity level and performance of our athlete or the client. Plus, it will decrease the injury rates. Hope you understood it. Thank you so much. Questions are welcome for this session. Thank you so much.